Okay. Oh, wait.
Oh, never mind.
No, you're right. She's not coming today. She's coming tomorrow. She just texted me back.
Tell her we're thinking of her.
Yes.
So she's not coming?
Not today. She'll be here tomorrow.
She has to be here for her health. She has to be here for her health.
Yeah. Yeah. Okay. Are we ready, guys? All right. All right. Good afternoon. Today's October 21st, and it is 5:03. As a quorum of the committee is in attendance, I'd like to call to order the meeting of the Central Health Ad Hoc Community Care Liaison Committee. As a reminder, some of our committee members and our board members may also be participating by video conference. I think we have Manager Jones on video conference. So our staff will be managing video and audio feeds of all participants closely to make sure we have a legally compliant meeting at all times. Now, do we have any public communications at this time for this committee or for the Bylaws Committee? None. Okay, then we're going to proceed to the committee agenda. So today we have a couple of things to cover with the liaison committee, and we have about an hour and a half because we then have another committee meeting after this. So we're going to keep this one to an hour and a half, so that there's also an hour and a half for the Bylaws committee. So we have a couple of things. Most of our time we're going to be spent going through a list of potential issues for the conversation around the co-applicant agreement, and that we'll be doing in closed session, I believe. But we do have, I want to take up first an item that for us to consider voting on, and that is the item number 2. Review and take appropriate action on the annual joint staff planning and budgeting methodology pertaining to the health center program funding. Now, what this is, and Dr. Lee, I'll ask you to speak to this in just a minute, but what this is a document that Dr. Lee and Dr. Yagoda were able to develop together with their staffs. It's the budget methodology for pertaining to how it's a process for the annual process for working through the budget with CUC. So it covers a number of different things, including what happens during the middle of the year if there's changes to the budget, and it specifies when those kinds of things need to come back to the full board. And if you guys, so there's that. It is agreed to with CUC, and it is, the importance of this document is twofold. It is a document that our staff will follow, as well as CUC staff will follow when they're doing the budgeting process. But it's also guidance for any language that needs to go into the co-applicant agreement, because it's a portion of the co-applicant agreement, and it's an example of language that our staff was able to develop that's agreed to for the co-applicant. But for purposes of to ensure that there's clarity for Dr. Lee and for Dr. Yagoda and the CUC folks, we need to vote it just to make it clear that he's got the approval of the board. So what we would do is would recommend it to the full board, and it'd be on tomorrow's agenda. Now, I don't know if you guys have had time to read it. So if you feel like you need more time to read it, we can set it aside and come back to it. So, any thoughts from anybody about Geronimo and Elisa first? Maybe give you a few minutes. Or I also want to tell you that I have reviewed it, and so has Maram, Dr. Musaidev as the chair of the budget committee. So,
And this came from?
it was generated by Dr. Lee and Dr. Yagoda.
Okay.
I don't know if you, is there anything you want to say about it?
Maybe summarize it, Dr. Lee?
Yeah. Mm-hmm.
If I may, just to clarify, we are on item 2, right? So
Yes,
you just
I'm
kinda-
sorry, we're
You
on
just kind
item
of
2.
read the topic without reading the number.
Oh,
And-
I'm
And
sorry.
we did skip the minutes, so if you want to go back and do the minutes before you go into closed, so.
Okay, thank you, sorry about that. Let's finish this, then I'll go back and do the minutes. Okay, go ahead, Dr.
We
Lee.
didn't do minutes?
So thanks, Chair Kitchen. And just as you said, this is a document that has been reviewed and approved and voted by the CUC board.
Yeah,
A version that's very close to this.
I don't know if the board voted it, but they approved it
They
in whatever
approved
way they
it,
normally do
approved
that.
it. And prior to that, this represents about 6 months of iterative work, largely between Jeff Knodel, Joyce Sloan, those two CFOs, John Morgan, Nick Yagoda, and then multiple others weighing in at various points. I imagine there have been about 50, like 50 iterations of this, but what we essentially have here is an agreed approach to the common bottom line budgeting process that took us through the FY26 planning successfully. And what we see here, I think, is by and large very consistent with my understanding of the current co-op agreement. So we are within those guidelines, and we developed the goals together. Then we reviewed the various proposals together. We sorted them in a disciplined process right alongside all the other business proposals for the system. And once we ultimately agreed on the funding for that, you see that number here, 98.8 million. That is the agreed amount of funding. And then you see below that, bullet number 2, that number will basically be distributed in 12 monthly payments with the process to reconcile and maintain a 30-day cash on hand, a minimum balance, and that we will review, no less than quarterly, and that review will be reported out to the Central Health Board. So transparency here, are we on track? Any variances that are needed? And we'll also regularly discuss variances, on a more granular level. And that if at any point in the year an amendment needs to occur, this is very important, that amendment then has processes that ultimately require approval by the Central Health Board because we're changing that budget. Likewise, I imagine by the CUC Board, but this pertains specifically to Central Health Board approval. And then below that, you see what are the kind of items that incurs. So this is not for, small items. It's incurrence of debt of more than $1 million, acquisition of an entity or line of business, divestiture of health center assets that significantly alter service delivery. Not minor things. More than $500,000 of downside risk in a payer contract. Leases, real estate purchases, or one-time expenses greater than $500,000. So sort of giving a sense of the scope of issues that really, must be noticed and discussed and agreed to. And that also includes that if there are HRSA scope of service changes, that we will do that collaboratively before final recommendation approval to the CUC board. And that if there are any out-of-scope activities, those must be agreed to. And if there's going to be any use of health center funds toward that, we certainly must agree as a health center grantee. And then the final bit refers to the public health reserve that the board has voted in the budget, in which there's sort of a 50-50 contribution to what for this year represents 30 days of cash on hand. And there's recognition that from year to year, time to time, those amounts may have to shift. And I expect they will come back through the budget process for approval year over year. But the overall way in which this is done, consistent with the co-op agreement, I think is what is most material here. And we feel really good about this, I would share. This has been a moment of lots of thoughtful and adult discussions going back and forth and finding our way to a really good outcome. And so, appreciate the opportunity to share with the board and appreciate the board guidance around this.
Let me highlight one other one that I think it's important to highlight. That's the next to the last bullet. I mean, you just mentioned it, but for the board, I just want to highlight it. It says that, because we've talked from time to time that, maybe the CUC board might need to do something out of scope. But what we're saying here in this bullet is that if CUC will notify Central Health if it has any intent to establish activities or provide services outside of the HRSA approved scope of project. And then it says any use of public health center resources. In other words, any use of resources that are resources for the FQHC. If there's any use of those for any out-of-scope activities, that either has to be jointly approved by CUC and Central Health, and it specifies in here that includes the approval of our board. So our board would have to approve for that, or they have to use funds that are not health center program income. So this is just thank you, Dr. Lee. I wanted to point that one out for folks. So, questions? Ronimo, do you have any questions?
I do. I have two. I think one question is around, and I can't remember, Dr. Lee, if you mentioned before, the sequence of this. Like, you all, from an administrative perspective, negotiated this with the administration of community care, and then the board. Has community board approved this, or are we the first ones to approve?
They have.
They have approved.
Oh, well, the way that I don't know exactly what their processes are, but I did talk to their chair, who has seen this and said that they approved it.
So we're the final.
Yeah. Yeah.
And then the second one is just more of an observation to me that I think as we continue to evolve, that that hopefully there won't be a need for this kind of a document. And what I mean by that is that and then as the newest person on the board, my biggest question is alignment to policies. Like, for example, the whole purchase of new lease of real estate, we talked about creating a facilities policy, the capital one-time expenses, and about kind of the direction that we want to have around that particular policy, and alignment to policy, so that as the board continues to evolve and create these policies, then the administration will be able to just administer them, so that not ideally, but maybe that in the future, the administration of Central Health, the administration of community care, inform us that they're negotiating based on our policies and our guardrails. So, but in the meantime, I appreciate all the work.
That makes sense. We're in a process. We're in a process that's going to involve discussions around revising the co-applicant agreement, and so this is kind of a piece of that, And so otherwise, but I hear what you're saying. That is normally we wouldn't have this separate like this.
Yeah, approving an administrative kind of record.
Yeah. Or approving an administrative process.
Process.
Yeah. Okay. Any other questions?
Want to ask Elisa before?
Did you have anything?
Oh, no.
No questions? Do you have a question?
It's not, well, maybe it is a question. I just want to make sure that we all understand that as we're going through our policies and bylaws, tweaks or recommended changes, if any are to occur, that we take into account the fact that we need to approve those by the board prior to the full development of other additional policies that may be impacted by whatever it is we decide.
Okay.
Okay, so I just want to make sure we don't put a cart before the horse.
Yeah, and this is just, it's because of the connection between this and the co-applicant agreement.
Correct.
Is the only
That's
reason.
right.
Yeah.
That's right.
Okay.
And just one tweak.
Yep.
I just wanted to know, I know, Doctor, you said that the Community Care Board has already approved this.
Yeah.
Well, because when you made your opening comments, I think you said that it was basically substantial. This was substantially, or basically, for all intents and purposes, this was agreed upon. For me, I'm one of those literal persons.
Yes.
If there were any things that were not,
Yeah. As far as
I want to know if there were any language or provisions that had not been initially or finally approved.
I can be more precise. So basically, the only changes that were made to this in the last day or so were on our side.
Okay.
In other words, they were.
That's fine.
And when I mean on our side, it means that I suggested some clarifications, as did Dr. Musaitif, that clarified when it comes back to our board. Because there was language in here that said CH, Central Health, and CUC approval. So I suggested, and Dr. Musaitif suggested, that that be specified, including coming back to the Central Health Board.
Within a timely basis, so.
Well,
prior to-
according to our normal process, basically, which we do right now.
Okay,
Yeah, because right now we approve the budget and amendments to the budget.
I mean, it wouldn't be anything we would be hearing 6 months down the road.
Right.
That's all.
Right.
Thank you.
Huh?
I said just 4 months.
Yes.
And,
Okay, so let me just go around,
Oh, and just to confirm, and these have been fully transparent. So
Yeah.
Dr. Yagoda reviewed these updates.
Yeah.
It's simply clarifying what so I think everyone is comfortable. There should be nothing surprising or controversial here. Yeah.
okay. So, Shannon, do you have any questions about this?
I just wanted to inquire as to the smooth, consistent flow of what happens at Community Care Board onto our board on these type of things. Will we have someone sort of running interface so that we'll have a heads up that things are on the way, or will we get them as they come straight out of the office of the board of directors of community care, if that makes sense?
Well, that's a good question. It's something we should talk about. This particular document is following the process we put in place for the co-applicant agreement changes, which I think would be different than the process for policies. So, yeah, can we talk in the bylaw committee about the process for policies? Because there'll be other policies that relate to CUC. Would that answer your question? I mean, this is just following, you want me to talk about that process for the co-applicant agreement?
Fine at that time. I just wanted to make sure that there's a place in which that process
Yes.
happens.
Okay. All right. So, yes, this committee is where we talk through, this committee is where we talk through the different provisions of the co-applicant agreement, and as we move forward with talking with CUC about that. The bylaws committee is where we'll talk about policies and the processes for our policies. Okay, do you have a
I
question?
just was reading that in regards to Shannon's question, that the CHC and CUC staff will review actuals to budget on no less than a quarterly basis. So
Yeah.
there should be no surprises there.
Right. Well, the other thing, just for everybody to remember, is we've been getting in our budget and finance committee meetings every month,
Yeah.
the financials from CUC, so this, I think this follows existing. Okay, are y'all comfortable? I have to look to Elisa and Geronimo. Are y'all comfortable with moving this forward to the full
Yes.
board?
Yes.
Okay, then I need a motion.
Okay. Do you have a motion now?
Yeah, let's see, you can, here it is.
I move this one here.
Yeah, right there, okay.
I move that the committee recommend that the board approve the document summarizing the annual joint staff planning and budgeting methodology pertaining to health centers program funding.
Okay, those in favor?
Second.
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 Yes.
Second.
You second.
Okay,
Then we'll take a vote.
any,
I second it, so now we just need a vote. You just went out of order.
yeah, we'll take a vote. I think we have to take a committee vote, and you're not on the committee, but that's
Okay.
okay. This is a consensus thing.
Okay.
I'm doing this by consensus.
Okay, super.
Because I want to make sure that you and Shannon and Cynthia are good with this too. So, okay. So I think we have, all in favor?
Aye.
Okay. All right, so now we'll move on. So that'll go on consent for tomorrow's meeting. All right, so now we're going to go back to item number 1, which is approve the minutes of the September 18th Ad Hoc Community Care Liaison Committee. I move that the minutes of the September 18th Ad Hoc Community Liaison Committee meeting are approved. Second, all in favor? Okay. All right, now we're going to move on to item number 3, which we need to go into closed session for. So let me read it first. Item number 3 is review and take appropriate action on key issues related to the co-applicant agreement between Central Health and Central Texas Community Health Centers, DBA Community Care. Let's see. I announce that the committee is convening in closed session to discuss agenda item 3. 4 and, well, we don't, 5 is not, possibly 4. And number 4 relates to the community, number 4 is review and take appropriate action on the community care CEO personnel policy. Okay, so under Texas Government Code, section 551.071, consultation with attorney. So the time, the day is the 21st, October 21st, and the time is 5:23, and we're going to go into closed session. Okay, so it is October 21st, the time is 7:08, and we're entering open session. So I am ready to take a motion on item number 4.
I move that we accept the community care CEO policy, personnel policy as discussed in closed session.
Second, Geronimo, all in favor?
Aye.
Aye. Okay. All right, I'm gonna, item number 5, I'm gonna defer that to our next meeting. Item number 6 is confirm the next ad hoc community care liaison committee. We don't have the date yet, but we'll be scheduling that soon. At this time, I'm ready to accept a motion for adjournment. Second, all in favor?
Second.
Okay, we're adjourned. All right.
Sorry about that.
Oh, sorry. Good evening. Today is October 21st, 2025, and it is 7:16 in the evening. As the quorum of the committee is in attendance, I would like to call the order of the meeting of the Central Health Ad Hoc Policy and Bylaws Committee. As a reminder, one of our committee members may also be participating per video conference, so the staff will be managing video and audio feeds of all participants closely to make sure that we have a legally compliant meeting at all times. We're now going to proceed to the committee agenda. First and foremost, I'm going to ask to see whether or not we did have anybody signed up to speak in public communication. No. Okay, so the first item on our committee agenda is to approve the minutes of the September 22nd, 2025 Ad Hoc Policy and Bylaws Committee meeting. Do I have a motion? So moved. Elisa? May is moved and Jeronimo Rodriguez seconded. All those in favor say aye. Aye. All those opposed? Motion passed. Okay, are we going to have any closed session? No. Okay. I don't believe we have any need to speak in executive session? No. Okay. Okay. So, next item on the agenda is going to be receiving a presentation from staff to discuss and take appropriate action on Central Health policies and the process for policy development. Discuss and take appropriate action on revisions to the Central Health amended and restated bylaws. Pedla Cavazos and David Duncan will be presenting. Okay, Pedla, David's over here.
Good evening, Chair and Committee. Earlier today, we sent a list of, and David, I don't know if you want to. Earlier today, we emailed out a list of proposed issues for bylaw amendments. That list was sent to us by Chair Kitchen and Manager Valadez. David Duncan and Trilisha Brown also, I believe, proposed some changes, and I'm not sure if we sent that out yet. I know David shared with the chair regarding a conversation they had clarification around appointment of the chief compliance officer. So those are the changes that were shared with us, and Chair
Could I make a
Kitchen.
quick comment? Yes, please. I wanted to just comment that the document that I sent out, I have no expectation that the board, the staff and our attorneys would, I can't imagine that they would have had time to even read this. And I apologize for getting it out so late. So, and I intended it as a list. Some of them are suggestions for changes. Some of them are just flagging stuff for discussion. And then there's one or two places where I just thought that there needed to be clarity. So just wanted to reassure y'all that I didn't have any expectation that you would have the time to comment on them. And it's also, there's a few places where I attempted language, but I didn't mean those. I mean, I was just trying to express what I was doing. I expect y'all to come back as our attorneys to suggest what language you think is appropriate. Thank you, Chair.
Well, I was just going to point out that. Oh, it turned itself back on. Chair Kitchen did the issue that I raised that I sent you guys in just sort of a rough change is also, there's a corresponding point in Chair Kitchen's points about clarifying how that chief compliance officer, we just put what has been the historic practice, which is the board appoints an existing Central Health employee as chief compliance officer. So that's just the addition. And also the deputy administrator or the assistant administrator, depending on which term you use, is an existing Central Health employee. So that's just the one and only change we had. Yeah, yeah.
So with that, we wanted to just ask the committee, how would you like to proceed? Do you, Chair Kitchen, want to touch on the points that you and Manager Valadez sent? Or would you like the committee to just read and then we could come back at the next bylaws committee, which we will schedule in November, and have a TCAO will, and staff will do analysis and come back with proposed amendments?
I'll leave that up to the chair.
I'm sorry. I would prefer that we, since we have that information already in hand, that you please take us through that, if you don't mind.
Okay,
Okay.
I'm just gonna be very quick in the interest of time, just to explain what each of these areas, what I was thinking, and then y'all can read it more, and then of course our attorneys can expect something to think about. The first one relates to quorum. We had some conversation, about, committee quorum.
I
The first
cannot
one-
hear.
I'm sorry, Shannon, I'm on now.
Can you hear now, Shannon?
Now, yes.
Okay, thank you.
Okay. I sent out a list of 9 areas. The first one relates to committee quorums, and I suggested about 5 different ways in which to address what we had discussed already in terms of committee quorums. So you'll see all 5 of them there. And a couple of bullets relate to clarifying what a quorum is for certain purposes. And I also suggest that, the bylaws currently say that we can only have up to four members on a committee. I suggested taking that out so that there's more discretion about that. And I also suggested, and we could see what you think of this, David, but I also suggested that, we had a lot of conversation about the concern about the law as it relates to rubber stamping and placing things on consent, and that's one of the factors that makes it risky for committees to talk to each other. And so I've got some suggestion here that you can think about and come back and talk to us about how we might reduce that risk. So that's the first one. Second one is approval of policies. I was flagging here that right now we have an inconsistency between a couple of our, it's sort of an internal, you might call it an inconsistency, or maybe just something that needs clarification. The current bylaws require approval of all policies by the full board. And so, and that's what the language says. It says the board shall approve, etc. But then we also delegate certain aspects of policies to our CEO. We delegate administering, enforcing, developing, maintaining, but we don't use the word approving. So I think we need to, I flagged that because we need to discuss if all the policies need to be approved by the board, we need to clarify that. And if we're delegating some for approval by CEO, we need to clarify that. So I just flagging that. Number 3 is board authority. And I have to give some kudos to our chair for that. You helped point out some language that I put in here that I just think we need to clarify. We already have some language in here that speaks to the board's responsibility as the authority for governing Central Health. But I'd like us to make that crystal clear, and I think that my suggestion, David, that you can think about is referencing back to some language in the Health and Safety Code, and I think I miscited it. It should be 281, not 381. So that's what that section's about. It is, again, just clarity on the authority. And then number 4 is compliance officer. You spoke to that a minute ago, David. The other thing I thought would be helpful for clarity is to add a section to describe what the compliance officer's role is with regard or vis-a-vis the board. In other words, the board is appointing a compliance officer, And there's a reason for that, and so I think we just need a paragraph about, you know, what the compliance officer does in relation to the board, not their whole operational responsibilities in relation to the CEO. Then number 5 was collaboration with governing boards of affiliated or partnering entities. I was thinking it might be helpful if we added some language that just stated that one of the things this is under the section about boards' responsibilities, add a statement that part of our responsibilities is to develop approaches for board-to-board communications to improve and strengthen and maintain those collaborations. Number 6 is the medical committee. I haven't had a chance to talk to either of our 2 physicians about this, so I think they're going to need to weigh in. But I thought it would be helpful to clarify the functions of the medical committee, so I put some language that I thought might clarify it, but I really want to hear what Dr. Martin and Dr. Brinson think about that, because that section is pretty light and I think a little bit unclear on what the medical committee is responsible for. Number 7 is the assistant administrator. Again, some clarifying language on the assistant administrator's roles. Number 8 is records of meetings. I flagged this for discussion, Chair. I know that this is something that you have mentioned before and others have too, and that's about record keeping for the closed session portion of the meeting. They used to be recorded and they're no longer recorded. So I think I personally would like to see, I'd like to see them recorded. That may just be me, but that's why I put that there. Number 9, updates to bylaws provisions. There's a couple of things that might be old. The vision, the mission, the purpose sections may not reflect our current wording that we use when we talk about what our vision is. The seal description, I wasn't even sure what that was. We have a new logo, so I don't know if we may not need to change that, whatever. Anyway, I just flagged it for David to look at. And then I think I flagged also that there are certain sections that we might need to be careful that align with the co-applicant agreement when that's finalized, and I reference those there. Again, David, you can look at that and see what you think. So Chair, that's the list. And so I would just ask that our attorneys take a look at this, come back with recommended language, and then we can talk about it.
At this point in time, I really would like to hear from those of you that are on the board that are present and our committee members, if they have any thoughts on possible submissions, if they'd like to go ahead and offer them up right now so that David can get moving on proposed language. Geronimo?
Yeah, I had 2 questions, which might lead to recommendations, but one of them, David, is about whether the special committees and subcommittees language in 7.4 and 7.5, whether that allows us as a board to create committees of the whole, or is committees of the whole even a concept that we can
Yeah, it is.
do here? Does it have to be specifically spelled out, is all I'm saying? Or does this allow the authority to do that already?
That's a pretty layered question. Committees, I mean, just the concept of committees in Robert's rules, that book's this thick, probably a quarter to a third of it is about committees and how committees operate and what they're for. And there's a long discussion in there, a lot of discussion about committees of the whole and why you would have one and what they operate for. But I'm having trouble wrapping my brain around what Central Health would have a committee of the whole for. So that's something I can lay all that stuff out for you and say, here's what it says, and here's when it describes that, here's what it means.
Yeah, I can tell you what my thinking is. Like, there's been a lot of discussion about combinations of board members talking to each other because of the committees that they're in, and some of the work that we're doing, and I don't know what it's going to look like, but I think as we've been discussing, if the board wishes, or if we do in the future and we do less committees but more committees of the whole, so that we're able to not trip up into the whole potential violations of walking of the quorum. So it's it's just administratively or procedurally, however you want to describe it, it's like, well, if we do committees of the whole versus, for example, some of the committees that aren't spelled out, but if they're committees of the whole, then obviously we have the responsibility and accountability to be present for there to be a majority of the board here. That's on our part. But if that happens, then we reduce those numbers of combinations of violations of walking quorum. Not that we're doing that, I'm just saying, like, does this give
Yeah.
us the ability to do that?
Yeah, and can I ask
Sure,
a question?
yeah, yeah.
So, is 7.4 subject to the 4-person limit? And the committee of the whole, so is there something special about a committee of the whole other than just the number of people that are on it? In other words, do we have to designate it as a committee of the whole, or can
I mean,
it
that's,
just?
yeah, I would say all of the committees are subject to the
To
cap on
4-person,
committee
okay.
membership, yes.
Okay, so that goes to what you were asking. If we're gonna do a committee of the whole, we have to have language in here that we can do it, right?
So then I'm assuming that you're asking David if he can develop some language.
Yeah.
And share it with you so that you can present to us?
Yeah, because I think for me, I was just thinking, well, does this language allow us to do that? And does that give us the option as a board to govern ourselves in that way? And again, just to reduce the number of combinations of individuals that could potentially be a walking quorum. And then the second question I had was, and I didn't see it in here, and maybe it's in another process, but I think the last time we were together, which I really appreciated, I think we had a discussion with Dr. Lee about like these expectations of the board agenda meetings and like setting a clear expectation of, 5 business days before the actual, any committee meeting or board meeting, we get all the material, including the backup material. And within, I'm making these numbers of like within 72 hours before the meeting, we submit all questions, so that way that gives the administration the ability to go back. But those, would those go in the bylaws, or is that something that's already authorized from the bylaws themselves?
I can answer that. That's not something that would go into the bylaws. That would be a policy. Or an SOP, standard operating procedure, that would be developed.
Which we could also,
Yes,
we're policy and bylaws committee.
yes,
So that's a policy that can be developed
yes.
and approved by this board.
Or an SOP based on what current policy?
Or lack
We would
thereof.
develop a policy, a simple policy, and then
Okay,
the
got it.
SOP would have the more detailed
Got it.
Yes.
Got it, okay.
process steps.
Yeah, that.
Yes.
So that is what you're asking for?
Yes.
Okay.
Those are the two things I kind of like was looking for. In
So
the
welcome
bylaws.
quorum, committee of the whole, and then the second one is going to be the SOP.
Yeah.
Elisa, did you have any concerns or questions?
No, I think everybody's been covering them.
Shannon, are you still with us, Shannon?
Yes, I'm still here. I just have one question. Consistent with our conversation at the earlier meeting, are there areas that may run into conflict between their board, their policies and procedures and ours, and where is that rectified, or how is that rectified in terms of practice?
In
Are
the
you
form of
referring
a
to-
policy?
Are you referring to community care, Manager Jones?
Yes.
Shannon, I had flagged in my list that some areas that I thought that we might need to look at the language to make sure it aligns with the CUC co-applicant agreement, but there may be other things. I don't know if I caught everything. You're just wanting to make sure that, yeah, okay,
Yeah, just generally, I want to make sure that they're consistent because
yeah.
as we grow this entity, or as the entity is grown, you want to be consistent across the board, so as much as possible.
Is that it, Shannon, or do you have something else?
No, that's it.
Okay, Geronimo?
Shannon, your comment made me think of one other thing, because I don't remember if it's in the bylaws or but it may already be in policy, but do we have a policy that guides or requires the board to review every single policy at a certain sequence, like every 2 years, every
I think that's
4
the
years,
next, I
state
think that's
law?
the next
That's the
item,
next
we're
item?
talking about policies.
Oh, okay,
Wait
got
a
it.
minute.
Yeah,
Can I speak?
Yes,
yeah.
please.
The bylaws, that's a thought, because the bylaws say how often the bylaws have to be reviewed, but they don't talk about how often the policies need to be reviewed. So that might be something to put in here to clarify that.
The policy on
Or it could be a
policies,
policy
the
of
policy on
policies.
policies already
Yeah,
does.
that's right.
It says
Well,
every
you
2
could do
years.
it either way,
Yeah.
but it might be helpful to put it in the bylaws, because we need to clarify in the bylaws that the board's, which policies the board's gonna approve. So, or just clarify that the board's gonna approve all policies. And you could say, the board's responsible for reviewing all policies every 2 years, or something like that, which is what we do on bylaws. Or you could say, the board's responsible for approving this category of policies.
Right.
We delegate to the staff this category of policies, but we review all policies, every couple of years. I don't know what,
Yeah, I think that would be good governance, just to figure out that. I think some
Yeah.
organizations will say only the board passes policies, and anything that an administration does is a procedure. And that way, that's very clear about what it is.
Responsibility.
But if this organization is doing it a little bit different, it's like, here's the power of policy is the boards, but we delegate certain policies. But we just have to be clear about, that would
Which.
make for good governance about which ones we have, yeah. Yeah,
Oh, we did.
so once there's clarity, then the language in the bylaws can track that clarity. So,
So you wanna
that
go
or
ahead
the
and send
policy of
that?
policies.
yeah.
One
So
of-
you wanna go ahead and send that to David also for,
I think it's a question for us to kind of work through and to get clarity on. Dr. Lee, you were about to say something?
Chair Valdez, just to
No.
describe what's being handed out here. In preparation for today's meeting, I'm sorry we haven't had a pre-meet around this, but Chair Kitchen and Dr. Brinson and Perla and I touched base on this. You may recall that we had given out a book to
right,
the
boards
board,
that make a difference.
Boards That Make a Difference. This first page was folded in half and put in there in case you wanted the super Cliff Notes version of it. But then, so that summarizes the book. The book does more justice, but that summarizes the book's recommendation. And so that's helpful. Now we know what, Carver thinks is best practice, and he's a recognized authority. But a board member had asked us another question, a follow-up to that, which is there any evidence that governing in this way leads to better patient outcomes or better financial performance in the context of healthcare? And so the second document you see is a literature review that goes back about 15 years, and it attempts to answer that question. And the high-level executive summary is that there appears to be a pretty strong link between the Carver approach and improved patient outcomes and improved financial performance, and then there's details over the 13 pages that follow. So we provided this to the board in response to a manager's question. We want to provide to all managers just as context around this question. And then the meat of that is that Carver actually recommends, you may see, I don't have a copy in front of me, but I'll borrow yours, recommends 4 types of board policies. Ends policies, this is define the organization's purpose and desired results. What must be accomplished for whom, at what cost? Very important. That's the reason the organization exists. And then the second type of policy is executive limitations. What are the boundaries on which means are acceptable, right? Either because it's not allowed or because the risk is unacceptable. And the board says, you need to steer clear of these areas in the achievement of the board-directed ends. The third set of policies is around the board CEO linkage, as we were discussing, what is delegated and what is the accountability for what is delegated. What shall be brought back to the board through monitoring and evaluation, at what interval, et cetera, to ensure that there is compliance that the performance is achieving the ends and there's compliance to the limitations policies. And then finally, governance process. This is amongst the board to itself. How will the board organize its own work in furtherance of the ends, the limitations, and the board seal linkage? So those are the 4 types of policies that Carver identifies as board policies. Our board, should do what our board ultimately deems best, but we're just providing this as helpful context as we think about that. And part of the opportunity there is in this big book, I think are like 700 policies. So it would be within the board's purview to review and approve every one of the 700 policies, but it may not be practical. And so what is a way where the board can control all the things that are most important? Where are you going? What needs to be accomplished? What shall not be done? How do we know that that's happening? And then what is the board's role in supporting that? Carver would offer those are the most important. And then there may be areas of depth where the board goes deeper, like the co-opting agreement, for good reasons. But that then the other 695 policies, need to be assured that they are consistent with those key board policies and need to be shown to be accountable, that may not need to be reviewed and approved one by one. And so that's a thought there to how to manage the meeting time and really focus on what matters most.
Thank you. And do you have a recommendation as to which you would prefer? That you would recommend to us as a committee?
Yes, thank you for asking, Chair. I think Carver's system is quite elegant. In fact, there is an example of an ends policy that Chair Kitchen and Dr. Brenson and Perla and I reviewed this morning. That is a version of the strategy. I know we're in open sessions. I won't detail what it is, but it's a version of the strategy that is an ends policy that states at a high level, positively, potentially through vote, says this is what must be accomplished for system transformation. And I think that could be a really elegant and powerful way to express, give me and the staff direction, but also express to the public, this is what we direct Central Health to do. And so I think there could be a lot of potential value there. And also we could be really efficient and effective in the time we spend, in the board meetings and really focus on those things that matter the most for our patients. So that would be the recommendation, but of course it is the board's prerogative to set the framework.
Anne?
I'm kind of intrigued by the concept of just that you had mentioned before, Geronimo, about what you call a policy. So the board approves all policies, but there are things that are not policies. They're like, if I heard you right, that are like operational procedures or processes. And the reason I'm intrigued about that is because if I can use the word policy and just understand that anything that's a policy is something the board has responsibility for approving, then I don't have to distinguish what kind of policy it is. But we still have to determine what we mean by that. In other words, what's a policy for the board to approve versus what's a operational process? Is that what you were thinking, or is it something else?
No, I think that's right. And all procedures are, the administration will have the responsibility to say, under policy HR
Okay.
1-2,
Okay,
the president has been delegated the authority to do the following. And here's the procedure for that.
okay,
I'm trying to think of disciplinary action or something.
yeah.
Something that they would, but all this is done in an iterative or generative process with the administration and the board. So there's a
Okay.
healthy tension and we're working things out. And sometimes the policy will be there and sometimes the administration will say, well, we're gonna have to go back and give us a couple of weeks or months depending on how big the policy is. And then come back and here's the procedure and it should align with the policy. And if we don't, then that gives us an opportunity to clarify the policy.
Okay,
And so again, it gives a healthy tension back and forth. And it also gives the administration the grace not to be given direction all of the time.
okay,
So it's not, it's more of a healthy tension going back and forth about asking for clarity, us asking for clarity, them asking for clarity until we get to where it is that we need to be. But again, I really like this, the kind of, the types of policies and stuff, but I also think if you're gonna do the procedures part, you have to be very clear about what it is that you're
Yeah.
gonna execute too, but yeah.
so what you might could do is say the board approves all policies and the delegates to the CEO the processes, and then you connect them, like you just said.
The procedures and
Pursuant
everything.
to policy, whatever, here's our procedure.
Yeah.
And then there's then I would want, if we went
Check and
down
balance.
that road, I would want to build in a process for reviewing
Yeah.
the procedures.
The other part to this, that, I mean, I think that we can take advantage of the fact that systems have been transforming for the last 2 or 3 decades into now, is that, and Dr. Lee, you may already have done this, but there's a lot of really good governance programs that allow for policies and procedures to be tracked, and I mean, there's whole systems that have been created
Software.
that we don't have to recreate the wheel and go
Yeah,
back.
so we can track them electronically.
Yeah.
Yeah.
And so there could be potentially like an RFI process where the administration and the executive committee, for example, may review 3 or 4 RFIs, and usually they let you pilot or test. Not, I shouldn't say pilot because that's a big test them to see which one is most appropriate to our
system.
organization
Yeah,
and
that's right.
and thank you for that word, because it's like to our system, because it
That's
should be something that you want to
Systemic.
go to, or
You wanna
you're
grow it.
yes
Yeah.
and you're trying to reach to it and not just put order around what we're already
It's
doing,
flexible.
Yeah.
but actually have the ability and flexibility to grow into a system-wide.
A living.
Yes.
Well, and that way everybody knows what you got, in terms of policies and processes. You can track them.
Yes.
If there's anything that, you want to know, well, do we have a
Keywords and
policy on
concepts.
X? Then you would know right away, because it'd be
Right.
right there.
It would
And
show
if
up.
you have a portal to it,
Yeah.
That's right.
every board member
Can
and
access that
every
portal.
staff member would have access to those policies, so nobody's surprised one way or the other, and we all know the rights and responsibilities of the board, and the rights and responsibilities of the administration, and the rights and responsibilities of individual personnel. Because a lot of times, some of those policies, some should be accessed by all employees, like let's say, for example, HR policies.
Yeah, yeah.
And I would defer to David Every about since it's a government entity, what access everybody has to those
Yeah.
policies. But those processes are there for transparency, accountability, and frankly, when we change, they can just be uploaded and moved there. And I would apologize if we already have that, because I haven't
No, we don't.
access to it.
We don't.
Because I had that conversation with Bedla,
Yeah.
and how we want to set up accessing the policies, just to get the information for us as a committee and a board to know what our policies are. Is there a portal that we can access? Well, no.
I think there's a separate item on the agenda for
That-
policies
okay,
that we're
well,
kind of
comes to
straying.
that later.
And I know
Oh,
I know, there's an interface, and there's you can specify in your bylaws, but now we've kind of gotten into what policies say what and how we're going to access
Yeah, yes, we
policies,
do.
and so I think we've kind of strayed into that item.
Okay, great minds think alike. Thank you, Geronimo, for submitting that thought. That was a conversation we briefly had, Bedla, when we were talking about this very issue.
So can I ask a question?
Yes?
So David, can you write something for our bylaws that reflects that? In other words, consistency, here's how I would state it. The bylaws state that we review all policies, okay? And then somewhere we need to define that you need to define policy versus
Operational procedures.
process, yeah. And we've kind of got that in here now, but it needs some
Tweaking.
language, And so that's what I would say. And then I would suggest adding some language that says that we'll review policies
Every
every 2 years. You could make it the same way as we review the bylaws.
When you start off, you don't have to do all, how many do we
Yeah.
have?
700 plus.
700?
You know, I think I got clarity from Perla. We have 160 policies. We also have SOPs,
Right.
which take this up to that number, I think. And so what I think we're hearing is that maybe we just make them all SOPs for clarity.
Well, some of them are policies, some of them are SOPs.
Okay.
I mean,
Um,
you
but
have to
yes.
look through them.
Understood, right?
Because right now, we just call them all policies.
Yeah.
So we haven't made that distinction
Yeah.
yet.
And I think to start off, you could also sequence it, so maybe
Yeah.
we do 25%, like we
Yeah.
could sequence it
Yeah,
to and to Dr. Lee's point, the most vital ones are the ones we're gonna look at first.
yeah.
And then the others, you can kind of sequence into, so that we get into a cadence. And as a system, that's gonna be really important.
Yeah, that's right. Okay, that's another suggestion for y'all to come up with the said language.
Right, and I'll just quickly answer your question, Manager Valadez, that we do have an internal electronic system that holds all of our policies that staff are able to access. We haven't
Made it
discussed
accessible
or
to the board.
contemplated how the board might be able to access, but that's something we can look at internally.
Well, since 281 states that our board is responsible for the development and review and adoption of all policies, that would be in keeping with what we have been directed to do by the legislature. So
Yeah.
we're not going to shirk our responsibility, but we're actually going to now clarify it and put it in place.
Yeah, and yeah. Can I? And you guys may want to say, well, this says policy, but it's really more of a SOP.
Right.
So you can think about that, because I don't know that what would you suggest? I don't know if we need to look at all SOPs.
I think, well, one, you don't have to do this in 1 year.
That's
Yeah,
right.
yeah.
Right?
That's
And
right.
two, I think, again, this is the healthy tension between a board administration. If the administration feels like this policy is really already delegated over here and here's the standard operating procedure.
Well-
I mean, this is also, as I'm looking at this policy governance, quick reference, I mean, it is also just a discipline of continuous improvement.
That's right.
As we continue to grow and transform into a system, you wanna have continuous improvement as a
Yeah.
discipline. And maybe the first part of that is modeling that behavior for ourselves around
That's right.
our policies and trying to, but you don't have to do this in 1 year, like,
Yeah.
that's, I think we wanna make sure it's set up right so that we get what we need out of it.
Shannon, did you have something to say? We can't hear you.
Oh, I'm fine, thank you.
What is it?
What did you say? I'm sorry. Could you repeat yourself, sir?
It said, no, I'm fine. Can you hear me?
Yes, now we can. Thank you very much.
Okay.
Yeah, I think this is, since this is a good transformational project, you know, as we're moving in that direction, this is a new beginning for us. And I am greatly appreciative of the fact that you have staff and that you have, we have a CEO that's bringing these issues to us, and so that we as a board can be forced to address the issues that prior to now, I don't think we have in any significant way, shape, or form. So, I appreciate that.
Can I ask one question?
Yes, go ahead.
What, in your experience, is the portal available for the public?
I asked that too.
Yes.
Yeah.
I mean, if you look at, Dr., you can check out.
The public
Austin-
document.
Austin ISD went through this
Public
and put a
document.
system in place. And they actually, will show to the public what we get 5 days or 7 days, I can't remember the exact,
Yeah.
the dates, but they get all the material we get. And it was part of trying to build trust and transparency with the public, who always felt like, well, you're surprising us, we don't know about things, and you're voting on things, and we don't have any time to go and put our voice to it. And we started doing that, and I just want to say, like, within months, everything just, the temperature
Aligned.
went down, and it became more about questions about policy and impact versus, well, we don't trust you, don't have the material. Not that this organization has that issue, but I also think that with one link, with one button, they were able to look at the same agendas we were, with the exception, obviously, of executive session material.
Correct.
That is not available to the public, but I found their system to be, like, we changed it and made it into that, so,
And it relatively quickly.
yes.
Yeah, so I'm greatly appreciative of you bringing that up. Thank you. We talked about that just offline briefly, but not to this extent. And this is where we want to go. We want the public. This is how we're going to grow the public's education about central health and increase their trust in us. So and it's not only the public, but it's the other agencies that we work with. So that maybe at some point in time, we can all share with the public and with ourselves. I had one question, and only because it came up, one suggestion, only because it just came up. And that was in Dr. Lee's offering or providing us with the information to participate in ARA, the AARO, Austin's research organization's upcoming conference. I know at one point in time when I first came on the board, there were monies. I mean, the Central Health would pay for the registration fees for some of our board members to attend, for those that asked or that required it, assistance rather, to participate in educational conferences in order to build not only their knowledge, the subject matter knowledge, which is healthcare industry and anything that is relevant to that, impactful of that, but also for their own edification and make us a better functioning board. So I personally, I didn't realize that had been taken away, and if in fact it has been, then I suggest that it be reinstated. I know that I have brought that up, and I know that Manager Mustaitef has also brought that up, and I think that it's a good practice for us to participate and have access to ongoing education for our board members. If we have staff that we're paying for to go to conferences, then we should, at the very least, as a board who are responsible for development of policy and administration of the agency overseeing healthcare policies for the safety net population, also have access to that information. So I'd like to see that policy
Chair?
language being developed. Yes.
I'd like to second that. I think that, I think we should do that. And in my experience on other boards, that is a practice. Now, it's all a matter of setting the budget amount and the limits on it. But I have been on other boards, and I'm on other boards that do that. And it's for purposes of education or training of board members within within reasonable limits.
Right.
So.
Okay.
So Chair, is that something that you're suggesting that you put in your bylaws? Is that what you're saying? Or
Well,
are you
at
just
least a
bringing
policy.
this-
Policy.
Okay,
No,
you're
that it
saying
be a
this is
policy.
Yeah.
Yes.
Policy.
Okay,
If-
wanted
if-
to make sure we're
Yeah,
still
that's
still
right.
talking
Because
about
if we have
the subject matter.
No, if we have staff that's offered this opportunity, and we pay for their travel expenses to out of state, we should at least be
Yeah.
able to do that for our board members who are responsible for managing that staff. Thank you.
And I hear you loud and clear. I would like to defer to TCO to weigh in whether that is allowed. If it's allowed, I think it's a great idea. My understanding is it may not be allowed as a form of compensation,
Yeah,
but I want to make sure that I understand correctly what the legal guidance is.
We can
If you
look
can
at
research
that.
that, I'd
We
appreciate
can
it.
look at it.
Thank you.
Yeah, I don't, yeah, please research it. I've been members of other public bodies that can,
To do this.
I'm not aware of any prohibition on it, so.
Okay, anything else before we move on to the next agenda item? Okay, so then our next agenda item is receiving a presentation from staff to discuss and take appropriate action on Central Health policies and process for policy development. Andy Buell? Did he not know he was going to present today? She? Did she not know that she was to present today? Andy Buell?
Andy presenting the development of policies, I thought that this was the follow-up question. I'm sorry, I thought during the prep that this was a follow-up question.
We didn't get the first presentation, much less this one. That's right, we didn't get it the first time. To present. Would you like for her to present at our next meeting?
Yeah, we could do the next meeting.
Okay, Monica and Bella, so that we don't have to lose any time, we can go ahead and hear from her at the next meeting? Okay,
Okay.
that'd be great. And then discuss updates on matters related to policies recommended in the performance review by Mazars USA, who was contracted by Travis County Commissioners Court. And Dr. Lee, Monica Crowley, and Katie Coburn will be presenting to us on this item.
November. Yeah, the czars item is for November.
It was my,
Apologize.
I'm sorry, it was my understanding that we were gonna get that presentation today, because we had not yet seen, something, unless you can identify and send to us.
Policies identified in this matrix.
Okay, so, and yes, so I'm gonna say, my understanding, and I apologize for this, on the previous item, was that the list of policies that David, and Perla had provided, and the discussion of what types of policies were board policies and what types were the other policies, that was the discussion. So I'm sorry, I thought that was a David and Perla item. And then we shared in the backup the list of Mazars items. So the Mazars items that have been addressed in that spreadsheet is in the backup.
Right, I see that.
But Perla, I thought the presentation on Mazars was coming in November.
Right, we shared the
Yes.
matrix, and you can see in the matrix that some were related to, some recommendations were regarding the need to establish certain policies. And so that was in there for your information. And then we are coming back to the board in November, because this is a document from, I believe, July. And so we are coming back to the board in November with a presentation on the latest implementation of recommendations, some of which are new policies that staff have created as a follow-through on the recommendations of this Mazars recommendation. So this was in here for your information again. And then I will add that in the past week, last week, we did share the 160 policies as a PDF with this committee. Also wanted to open up and see if there were any specific questions related to those policies that were shared. I think this is also an opportunity for this agenda item number 3 is also an opportunity for you, the committee, to request direct boards to either create or establish certain policies that you believe might be missing in that 155 list. I think you've already maybe shared some input in the previous agenda item So we can certainly work on what you
I
have brought up in the previous agenda item.
I appreciate that, and one of the things that I'd like to make sure that you understand is when we ask that information be shared, it's not to be shared just with this committee.
Yes.
It's also to be shared with the entire board, so that the board will have the information that they need to have in front of them to be able to make suggestions and to offer recommendations to policies and language development. Elisa, do you have something to say?
Well, I'm looking at, this is the material handed out to us last month, or last time we met. And in there, and I know you handed it out already this time. But I'm looking at the Central Health Policy Inventory list.
Yes.
And you mentioned if there's anything there that we want to see added. And I want to see more, some policies developed around our facilities and facility planning.
A specific development of a specific facilities plan.
Yeah, specifically, and I know that something's in the works, but I don't see anything in here. What I saw was infrastructure, but I think we need to have something, I think my comments to you guys last time was, policies on real estate, policies on facility, management, policies on facility planning, and I think those are the three that I had listed last time. I'm just going off my memory, but anyhow, now that you've asked the question, I definitely want to see something around, those issues.
Yes, and I think it's going to be a perfect opportunity to develop some of those policies as we take on the facility plan in the next, early next year.
I think that is tied to strategic planning and service delivery planning, so it's not necessarily, I think some of this, how we plan, assessing the need, the part of this joint community health needs assessment that we're doing with community care, there is assessing the need, there's planning for services that are needed to address gaps that are identified, it's determining what the best location for services are, and then if we've determined what the service and strategic program is, and what the financial policies are, I think it's this IFSOP piece before we get to the
Monica, with all due
facilities as well.
respect, that is not what I'm talking about.
That's right.
Before you move, you can come up with your strategic planning and thinking in terms of that these are buildings or these are things we need. But before that can even happen, we need to have a policy around that addresses that specifically, because that's what's going to give you then the ability to go off and do it, right? So that's what I'm talking about. It's more specific to that.
And I think one of the concerns that we have been forced to address as a board is coming into a meeting, we don't have the backup material, and then all of a sudden we're being told that, oh, and by the way, we're interested in purchasing this property, or we're doing this and we're doing that, and we have not had any discussion with respect to it, but we're expected to act on it. And so we've got to have a plan that looks at the big picture, and that we have had opportunity to input and decide what our priorities are as a board, with the assistance of our CEO and our staff members, so that we can look at what our priorities are going to be and what it is that we should be engaging in at that particular time, especially since we are now dealing with economic crises at the state and national level. Did I hit on anyone?
Yeah, what I was gonna recognize is that because we're in transformation, and I think as I heard the staff last time talk about how we currently own 3 properties and we're actually gonna hopefully continue to grow, there is a need for I just want to I agree with you, Manager May, a facilities policy would be helpful, a real estate policy. And then, Dr. Lee, to your point on previous conversation of the committee, an asset management policy that spells out clearly the fact that when we're using those federal dollars and our dollars, that those are protected when they're being used to buy some capital from, for example, from community care. And so I think what we're all saying is there's a need to strengthen the infrastructure policy piece of this. And right now is the right time to do that.
Yes, ma'am.
What might
Chair
be,
Kitchen.
what might be helpful is a conversation or some thought about what our expectations are, that of the content of that kind of policy. Tomorrow, for example, this is a different policy, but tomorrow on the full board, or it might be in budget and finance, I forget.
It's in budget
Anyway,
and finance.
in budget and finance, that, we've talked about that we needed a policy related to when we might fund community groups. So we're gonna use that time to ask the board members to just articulate what they would want to see in a policy, and then the staff is going to, So I feel like I want, for myself, I have a vague idea or a general idea of what I think needs to be in a real estate policy or an infrastructure facilities management plan. But I'm kind of feeling like I'd love to see a table of contents kind of thing, because I'm very familiar with what goes into a strategic plan. I'm not as familiar in what goes into a facilities master plan. So it may be that we need some more conversation about exactly what we're thinking needs to go into this kind of plan. And it might be appropriate to do that at the infrastructure committee meeting that's coming up on November 17th. Because I think, we have certain expectations, and we probably need to make sure we're aligned with what y'all are developing.
And to that point, I know we're a ways away from being there, but should we in the future entertain adding any additional big buildings to further expand our system? Should that be the case, we really have to have a good handle on all of these facilities, the master plan, having an opportunity to really have an understanding of our real estate, because once we start adding something that is that much bigger, the management of that, together with the management of all these other buildings, is gonna be quite the task. And on top of that, we're talking about a lot of financial resources that are gonna be going into those, right? And we're gonna be talking about operations.
That's right.
Anyway, the operations, the maintenance and operations of those buildings. So anyway, with that in my mind, I'm headed in that direction, so I wanna get all this homework done, if you will. So those are my comments.
Yeah, and for me, it'd be kind of like, homework to me is like, okay, and we've seen some of these pieces, we just haven't seen it all together. It's like, what's our list of properties? How old are our properties? When are these properties going to, fall
Depreciate
apart?
out.
When is the
That's
roof
right.
gonna be, that level of specificity? And we've seen list, so we have some list, but I'm not sure that we have a comprehensive view of, to me, that's what the facilities plan involves, is that level of detail.
Dr. Lee?
Chair Valdez and Manager May, Chair Kitchen, Manager Rodriguez, I just want to say I'm with you. We're with you. Right? I hear you loud and clear. And these things that you're describing absolutely must be things that are coming in the near future. Tomorrow evening, I hope your sense of what we put before you is that while we haven't arrived in the promised land, we have advanced our approach to an integrated strategic operational financial plan view, and sharpened the question and the rationale for it. So look forward to your feedback after tomorrow evening's presentation. We've been very hard at work on that. On, I believe, November 12th, our next strategic planning committee we will be bringing forward an example of an ends policy with some limitations policies component to reflect system transformation, which is not specific enough to cover each facility, but actually encompasses the whole thing. And so we'll look forward to your feedback around that. And then, over the weekend, I read through page by page the AISD Master Facilities Plan to familiarize myself with that tremendous undertaking and understand, that incredible body of work. We won't be able to turn that around in a day, but really just really diving into what would that really look like. So just want to say I hear you loud and clear, and we're on it. We're building toward it. It's a transformation process, and we appreciate the board's guidance and also a little bit of patience and grace as we take these steps one at a time.
Well, as we move forward to providing this information to the board members, and we do that, make sure that at each meeting then, we have a timeline. And in that timeline, this is what we know we're going to discuss, this is what we're going to accomplish, and this is what you all have planned in the works. And so that we're checking things off. And we can evaluate ourselves to make sure that we as a board are accomplishing what we need to accomplish for Central Health in order to be effective. So those are the things that we need to have, and which goes to the need, the critical need to make sure that we're getting our backup materials on a timely basis. Not if it appears, just so long as we as a committee, because I'd like for us to formally adopt such language. If it appears as if we're not going to get that backup material, then it's not on our agenda. It's as simple as that. And not, somebody still has something to do. No. If it's not included in our backup material 5 days or 3 days or 4 days in advance, then we're not discussing it. No action will be taken, and you all can just wait, unfortunately.
And that is a really, I think,
But
good-
that's
good
critical.
point. And as we begin to
Grow up.
evaluate our governance processes, I think we also need to have a conversation around the staging of meetings and committees, so we as staff have enough time to prepare information and present it to the board in a timely manner. And I think that's something that we hope to present to the board as well
That's
later this
something
year.
that we had actually been receiving.
Yeah.
Because, when we would have our meetings, we would have staff tell us, okay, this week is when we're going to do this month we're going to do this month we're going to do this. And
Yeah, and
so we've already been doing that, but
well,
we haven't necessarily stuck to it.
we haven't done it as consistently.
That's right.
Because
It's
we
been
were doing
inconsistent.
it as part of the executive committee. We haven't been meeting as executive committee because there really hasn't been any need to do that. And so I've been working, Cynthia Brinson and I have been working with Perla and
Good.
Pat
Kelly.
when to do meetings. The other problem is that we have so much on our plate this
That's right.
fall that's unusual. This is hopefully not the way we're going to continue, but we've had all these retreats we've had to do. We've had the co-applicant agreement stuff. We've had the litigation committee stuff and the regular. And so that's one of the reasons for, and some of the stuff we don't know about ahead of time, so we can't plan a meeting that far in advance. But we could still adopt the approach that we're not going to take up something unless we've got the information ready for
That's
it.
exactly right.
And unless it's an emergency that we really need to, so we can do that. But some of the some of the uncertainty in terms of when these meetings are is because of the fluid nature of what we're doing. And that's not. I mean, just talking about the let's see, we're in open session, right? Okay. All right, there are various things that we've had to discuss.
Right.
That we don't entirely control the timing on. And those things we've had to schedule meetings for, and without as much notice. So we're not in a position where we can say we're gonna have these set meetings over the next 6 months. We have some set meetings, but we've had to have other meetings in the meantime. And so that's just the nature of it. But tomorrow we do have the best guess about our scheduled meetings. And I say guess because there's still some things we can't control. So
And
anyway,
that's understandable.
yeah.
It's been a busy year.
Oh, I know, it's been a busy year. It's been a
Done a few
busy year
things.
since last August.
Yeah.
Chair Valdez, if I may, Manager Rodriguez lifted up an interesting point before about the conversation. I forget exactly which words used, but a conversation or even a healthy dialogue between board and management. And I think that's right. You know, we serve at the pleasure of the board. Whatever issues the board requests to be brought before the board, we will work on. But there's a point at which if there's enough issues, whether in our control or out of our control, it just sort of floods the engine, you know, and we don't have the bandwidth or capacity to do the diligence that we know it should be done and want to do. And so some of that conversation is asking, like, what is the level, right? We will do whatever the board directs us to, but it may result in us having many meetings and less preparation time and, you know, and backup not being available. And so we need the board to help us a little bit, really identify what is most important so we can focus on that and get it to everyone in advance. And so we appreciate that conversation.
I don't know if we're in the open to possible changes with respect to our meeting schedules, but we know we did used to meet twice a month. When I came onto Central Health Board, we had twice a month. We had bi-monthly meetings.
Yeah.
As a board.
Yeah.
And, you know, I don't know that we're going to want to go back to that, but for purposes of understanding that everything's going to be on the table, you know, those may be things that we need to consider in light of the fact that we are trying to transform ourselves into this system.
Yes. And some of our colleagues around the state only meet once a month.
Oh, I understand.
Right? Even that they're 3 times our size. But to do that, this sort of Carver recommendations, I think, is part of the path to being able to reduce the number of meetings, but increase the heft of each meeting. Of course, the board directs the framework, but that's the reason we brought it forward, is there's a way to maybe get the best of both worlds.
Yes.
Well, and, you know, the other thing is, well,
Go ahead, finish your thought.
I think that as chair, I have responsibilities for working with our staff. I do, and Dr. Brinson and I do, to try to work out the meetings, and we've been doing that. You know, so, and the chairs of the committees
Yes.
each have responsibility for when their meetings are held and what has to be covered. So we're doing that. And I think that's working fine. I think that it's a matter of understanding the level of work that we have to do, and I think that might be a good suggestion that you just made, you know, in terms of we're just going to establish standard, you know, while we're in transformation. I mean, the groups that meet once a month, they're not in the kind of
Business we're in.
change that we're in right now, you know. So anyway, we can have more conversation about this tomorrow. It is an agenda item tomorrow, so.
Thank you. Okay. Are there any other issues that we need to address before we adjourn?
I think we've covered it, and thank you, Monica, for stepping up. I do
Item 3 and 4.
now realize that her name was not on the agenda request form, so, you know, quick on her feet, though.
Okay, that's what a lawyer does.
Thank you for your patience.
Okay, Dr. Lee, is that it?
Yes, ma'am.
Okay. Any board members, any committee members? No? Okay, in light of that, then I'd like to confirm the next Ad Hoc Policy and Bylaws Committee meeting date, time, and location. Currently, we do not have an established or set Ad Hoc Policy and Bylaws Committee meeting, but I do believe we will be meeting in November.
Yeah, can I say one thing?
Yes.
Just a reminder for the board, I'm sure you all noticed in the bylaws committee, in the bylaws, when you read it for the 5th or 6th time, that we have to vote on bylaws at the annual meeting. The annual meeting is in December.
That's right.
And we have to make the recommendations and get them to the board members 7 days in advance.
Correct.
So that's the timeline.
That's right. So,
Okay.
Staff, you understand the timeline we're under. So that's the timeline y'all are under. So anyway, I appreciate that. Thank you, Chair Kitchen, for bringing that to our public's attention. And as soon as we have been, I guess it's been put on the agenda for our next board meeting, that information will go out to the committee members and to the entire board. By that time, though, I would hope that if there are any information that has not been received by the full board, Perla, if y'all can make sure that they get any necessary information to be able to review and present recommendations. Okay. At this time, I'm ready to accept a motion for adjournment. Okay, motion has been made by Manager Elisa May, seconded by Jeronimo Rodriguez, seconded by Jeronimo. All those in favor say aye.
Aye.
All those opposed? Motion passes. Thank you.